This is Dr. Daniel Paul, orthopedic doc with Easy Orthopedics, and today we're going to talk about how you know if you need to go to an urgent care versus an emergency room for any sort of musculoskeletal or orthopedic injuries. If you like this video, we put out new content weekly, so please like and subscribe. So ER, urgent care, like lower severity of care, higher severity of care. So when should you go where? A good rule of thumb is if you can't walk, you should really probably go to the ER. Now it's possible you just sprained your ankle and maybe you can just need some x-rays and go to the urgent care and get a boot. But if it's any sort of deformity or anything like that, where your ankle looks really funny or your finger looks really funny or your wrist is bent all sort of funny, don't waste your time with an urgent care. Because in an emergency room, they'll put those bones back in place and splint them and with like a plaster or fiberglass splint. And that's just something they're not going to do in urgent care. They'll take an x-ray, tell you it's broken, go to see an orthopedic doc. In the meantime, if you can't get in to see an orthopedic doc right away, those bones that are not in the right place may heal wrong. So you at least want to go to the emergency room to get those bones put back right. So even if it takes a week or so to get into the orthopedic doc, everything is sitting more or less where it's supposed to be. Even if you need surgery to put a plate or something on it, it's going to be lined up, and it's much easier to plate something that's been in the right place than something that's been in the wrong place for like 2 or 3 weeks. So that's I think a good rule of thumb. But if you've got something and you don't think you broke anything, it's just a strain, then don't waste your time with the ER. They're just going to sit there for longer, and take x-rays is going to be a lot more expensive. So then an urgent care is more appropriate, where they can basically take an x-ray, make sure nothing's broken, give you some muscle relaxers, some ice heat. They always tend to give you some sort of medical equipment too, which I don't know if is always necessary, but they seem to always do that. And so that's kind of the delineation. If you have any sort of deformity or you can't walk and think it might be bad and bones need to be put back in place, go to the ER. If that's not the case and you're able to get around and it just feels like something strained really bad, need some medicine, just some simple things, go to the urgent care. They do have orthopedic urgent cares, which will kind of be the best of both worlds, but not every place has those. So I hope I was able to answer your questions about when to go to an ER versus an urgent care for orthopedic or musculoskeletal injuries. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any medical advice because this video and all my videos are for educational purposes only. Thanks for watching.